Do you see the advances in telehealth that's come from COVID as a positive for medicine?
If there's a silver lining to this pandemic, it's the advances made in telehealth. But this is a two-edged sword. Incorporating telehealth into medical practice allows patient safety, access, and probably 25 to 30% of primary care patients can be evaluated using telehealth with totally satisfactory clinical outcomes. But the 70 to 75% of patients that optimally require a direct physician-patient encounter may not have as optimal outcomes. So physicians are going to have to develop best practices for using this technology, and the use of technology must be incorporated into medical education. And what is still needed, however, is to ensure compensation is commensurate with this type of service provided. If a physician in his practice invests in new technology, services, training his staff, and changing the way that they were routinely seeing patients, they must be compensated for this new type and level of care. And this is something we continue to advocate for. And the big question that I have is, will compensation for telehealth be limited to pandemic legislation? It has been included in payment processes right now. What's going to happen when the pandemic finally evolves? Because it wasn't compensated in the same manner prior to the pandemic.